The writ has dropped in BC. The election campaign now officially underway. Polls suggest it is a tight race between the NDP, led by David Eby, and the Conservatives, led by John Rostad. Both leaders have begun campaigning, and they are making their pitches to voters. That'll be one to watch for sure. Election Day is on a Saturday, October 19th. In BC, several mayors are among a group of officials urging the federal and provincial governments to help them with mental health issues in the province.
Today, we stand before you as a coalition, a broad-based coalition, demanding immediate action to be taken on the public safety and mental health crisis, gripping Vancouver and other communities across this great province of ours.
The group includes First Nations leaders, police. They sent a letter to the Premier before the election and the Prime Minister. They want mandatory care for people with severe mental health and addiction disorders, which the province says will be implemented. They also want some changes to the bail system and police to be present at Metro Vancouver's ports. Earlier, I spoke to Vancouver's mayor about why he signed the letter and what can be done to make his city safer. Mayor Ken Sim, thanks for joining us.
Thank you for having me. And by the way, you can call me Ken.
I'll try, Mayor. You're one of several mayors who has asked the provincial and federal governments for some help dealing with mental health and addiction issues in British Columbia. Can you give us a sense of the situation in your city right now?
Yeah, first of all, I think, this might go over like a lead balloon in terms of, it's cold comfort to people that have been victims or crimes or violence. Crime in the city of Vancouver is down. It's actually down significantly. But that doesn't matter when you have random incidents of violent harm that happen. Because people are, let's say, suffering from a significant mental health issue and or a severe substance use disorder, it jars people to the core. Yeah.
And so you felt that you needed to try and get some action on this. And one of the requests is this issue of mandatory care for, as you said, people with either severe mental health problems or addiction problems. Premier Eby says BC will bring in mandatory treatment for people with mental illness and addiction. What do you make of that? What difference would that make for you, Mayor?
It will make a significant difference because, I speak on behalf of the city of Vancouver, but you can this applies to pretty much every single town and city across the country. We do not have the tools to, take care of people. It's not in our mandate. So while we can react to, incidents after the fact, we have to get to the root cause of it. And there are people that are suffering who should not be on our streets. My background's in elder care. And if I were to if you were to hire us to take care of someone's grandparent who suffers from severe Alzheimer's or dementia, and we said we would let them direct their own care, that would actually be considered elder abuse. That would be neglect, and I'd probably lose my company. And right now in cities across this country, we are letting people with significant mental health issues who can't direct their care, literally direct their care. And so I think it's a great first start by the provincial government. We welcome.
Yeah. What do you say though to those, and there are people that have obviously very different views on this issue, Mayor, who believe that this kind of forced confinement, forced treatment doesn't work, and they actually compare it to jail, to detention.
Yeah, well, a couple of things. First of all, really welcome the different perspectives because, we live in a kind, compassionate country. And I can tell you what we're doing right now doesn't work. The situation's actually getting worse. And so I don't think it's compassionate to let people who need care not get it. And so that would be my response to them. And let's take care of people where they're at, but not leave them where they're at, and help them out.
Doctors, though, already can certify if there are people who are mentally ill that they do need treatment, can force them into treatment if they are a risk to themselves or to others. So what does this do that is needed that doesn't exist within the medical system already?
Well, first of all, the Premier said, by the way, it's political season in BC right now, and I'm not getting political. We do not take a position on who's in Victoria. It's our job to work with Victoria and Ottawa. So I do want to get that qualifier out there. And the provincial government, they've really stepped up, and they are adding 400 beds to this. And we need more, and so that's why we're approaching the federal government. But let me give you a situation. On September 4th, there was an individual who has a significant mental health issue and substance use disorder issue. With 60 previous interactions with police, and on very light bail conditions, that person shouldn't have been on the streets. And one person was killed, another person had their hand cut off, it manifested, like, we let the situation manifest into a criminal event. That the root cause of that's actually a healthcare issue. So my comments to the individuals who are against this: we hear you, we understand you, we're compassionate as well, but at some point we have to say what we're doing right now isn't working. People are suffering, both people that have these mental health challenges and people on the street, and so this is a different way of addressing it.
The letter, as well as this issue, also talks about bail reform, even though some federal bail measures were passed at the beginning of the year. Does that mean that you're not seeing a change in federal bail reform measures yet, that you need something more? Give me a sense of what is the issue there.
Yeah, this stuff will ripple through the system. And so, we've had some reform on violent repeat offenders, and we need a bail reform on just everyone else, because I can tell you, I'll give you an example. In the downtown east side of Vancouver, there will be situations where people have been arrested 800-900 times, and it's a revolving door. And so that manifests into more criminal activity because there are no consequences. But
presumably those are sort of non-violent offenses, just repeat offenders of smaller crimes, I would imagine.
Yeah, but and then these things can manifest into bigger and violent incidents as well. It's not as if people are going into these situations with all smiles and just walking out with stuff. Some of these incidents are violent. Yeah. And they may not be considered incredibly violent, but tell that to the shopkeeper who is just trying to run a business, and they get intimidated and they're afraid to actually approach anyone who's stealing stuff in their store, and they actually tell their team members not to do anything because the risk of harm, not that the actual harm, but the risk of harm is enough to make people stand down. It's just not right.
Yeah. Okay, Mayor, we'll leave it there. Maybe we'll talk again as this election kicks off and gets underway.
Well, thank you very much for your time.
My next guest has lived through some of the realities of what we're talking about there. Kyle Fawkes is the son of Glenn Fawkes, who died by suicide just days after being discharged from involuntary care under the Mental Health Act, as I alluded to there. Kyle, thanks for joining us this morning. Appreciate it.
Thanks for having me, Rosemary. It's really good to be here with you.
Yeah, and obviously so sorry for the loss of your father and what he went through. Give me a sense of your experience with involuntary care in the case of your dad for mental health reasons.
Thank you. Yeah, so my father passed away on October 10th, 2020, World Mental Health Day. He passed away after several disappointing interactions with the mental health system in the province of British Columbia over 2020, which ended and crescendoed in his discharge from Royal Jubilee Emergency Services just 19 days before his suicide. There he was involuntarily formed for a period of about 36 hours. So, when we're talking about involuntary care, I think definitely I agree. It's a tool in the toolbox that can be used to support those with mental illness. I think perhaps the issue is not so much involuntary versus voluntary care. It's the decision-making that really goes into deciding if someone should be detained in involuntary care. And I don't think that there's been enough emphasis on that decision-making. Certainly in our experience, it was very sort of superficial. All it takes is a doctor to assess somebody for a very short period of time and decide whether or not they need to be in involuntary care. And there's no legal obligation to speak with the family, which has certainly been something that we've been pushing for very adamantly, is some sort of legal regulation.
And given the way it ended for your family and for your father, I imagine that your other concern with involuntary care is follow-up and the fact that people are released and sort of go back to however they are living.
Exactly. So I think the system right now, it, detains people that probably don't need to be detained, and it lets people go that probably should be detained. And in my father's case, I think he did need detainment. He did need more help, right? And he was let go. And there's no system for follow-up after somebody's discharged, which is really disheartening. I think it's also, worth noting that British Columbia per capita detains the most people in Canada under the Mental Health Act. So, 20,000 involuntary detentions every single year. And I can only imagine that number is going to go up. And it's going to go up at a cost to the taxpayers in British Columbia. That's the other side of this, right? Is that the taxpayers are paying a lot of money to have people detained in the system. We're talking about, billions of dollars every year that's coming out of healthcare funds to keep people in involuntary detention.
Obviously, every situation is different, Kyle. If it's a drug addict, is different than a mental health illness, depending the severity of that illness. What would have been the solution for your father? I'm sure you've thought about that.
Yeah. So, I think for my dad in particular, I think, as I said, he did need some sort of involuntary treatment. He was extremely fearful and anxious about going into involuntary care. I think there's some good reasons for that. I don't really think we know what goes on in there. And I also think there's an accountability issue with the health authorities in British Columbia. There's been, wide reports about them flouting legal obligations when detaining people, which is a big concern. I think for my dad and for a lot of people, and I think what a lot of grassroots organizations in the province want to see is more of these what we call midstream interventions. So right now in British Columbia, there's counseling, and then there's involuntary detention once you're in crisis. And there's nothing really in between. And I think a lot of studies have shown that it's way more cost effective to invest in those midstream interventions before someone gets to a place of crisis. Don't get me wrong, we have a public safety concern in British Columbia. And I think that, the leaning into the involuntary system is definitely a strategy. I don't think it's the right one, but I think it would be a lot more cost effective if we leaned into things like, respite houses, outpatient support, better coordination with families. I think all of these strategies are where we to be focusing our time and energy, as opposed to, fortifying a detainment system that's, quasi-imprisonment in British Columbia.
Kyle Fawkes, I've got to leave it there. I'm out of time, but I really appreciate you sharing your story and obviously the advocacy work you've taken on in light of what happened to your dad. Thank you so much for making the time.
Thank you so much, Rosemary.
Nice to meet you.